Good afternoon, everybody. So, Master of Clinical Audiology. Who knows about audiology? Anything about it? Yeah? Very good. Ever been to an audiologist? No? Ah, let's talk about that then. Okay, so my name is Mridula, and I am the convener for Masters of Clinical Audiology. And why are we talking about this? Well, I'll tell you all about it. It's very exciting, really. It's a professionally accredited program, and it gets you it's not just a degree. It's really a plan in your, I guess, lifestyle. This is what you're going to be doing. This is what we do. And this will allow you to not just work in Australia, but other countries as well. So quite a few of our graduates tend to do, they want to do backpacking, but they don't have to because they can get locum jobs in UK. So it works quite well. There is, in general, a worldwide shortage for audiologists, and even in Australia, there are regional areas. So if you belong to a regional area and you want to go back, you may find that actually there are not that many audiologists in your community, and this is something you may want to consider. Audiologists tend to work, university setup like myself, but then we also have hospital settings, we have private practitioners, small clinics that audiologists run of their own, medical centers, speech and hearing clinics, schools, community outreach programs in the industry. In terms of our structure, like speech pathology, ours is very intense as well. In terms of the program, it's a 2-year program. It's an on-campus study. However, for your clinical placements, we do send you out to other areas in and around Sydney, as well as some regional areas, including Northern Territory. Our program is 64 credit points, so 16 units, and there are 3 every session. So we have 2 sessions in a year. Every session, 3 theoretical units and 1 clinical. We have, there's on-site staff, but we also bring in industry partners to come in and talk to you, to the students. We have ENTs, pediatricians, speech pathologists, I guess some of our supporters of the program, including how many of you have seen the Cochlear building? Yep, so they're active participant in the program and training as well. What else? So we are an accredited program, so we are accredited by Audiology Australia. So if you Google that, you will get through to the program and a lot of information that's publicly available, so you can learn more about the opportunities. When anybody comes into the program, we have a 3-day introductory workshop, which is followed by 6 weeks of lectures, and then we have 6 weeks of placements. So those placements are organized by us, and then you get to actually, pretty much session 1, you get to have a feel for what you're going to be doing and what the opportunities to showcase, I guess, what can be done. In terms of entry requirements, it's really very similar to speech pathology, but for a small thing that we welcome all backgrounds. The only thing we ask for is a GPA of 3. So simply because it is, sorry, I need a speech pathologist. It's just because we need, this program is extremely intense. So that's the only demand there is. So if you are one of those students, hardworking, interested in health industry, this is a good program. We do require the IELTS scores to be about 7. And we need a personal statement that can convey to us about your interest, which may just begin today because, I'm getting you all excited about this field. But from now on, if anything you find out, you want to talk about it, you want to convey your enthusiasm for the field, whatever you find out about it, put it in the personal statements. We do have some, I guess, Commonwealth supported places to help with the fees. But other than that, this is it. So we do have the info night, like Dr. Elizabeth said. It's on 16th of September. That's an info night. But we also have open day, 13th of September. So if you have any questions about it, come and talk to us. Thank you.